Hey, hey, it's Monday. Is it Monday? Yeah, it's Monday. It's Victory Monday. We'll go with that. Uh, February 13th, Galentine's Day. And I'm going to bring one of my Galentines on screen for today's IHKC Live. Lauren, how are you?
Did you just call me your Galentine? One
Absolutely.
of? That is
Yeah.
that is such an honor. Thank you. You are also my Galentine. Like we're
Hey, I love it.
but I'm good. How are you doing this fabulous Galentine's Day?
I'm doing good. The weather is warm here in Kansas City, and I'm looking forward to running after this. Well, looks like a walkish jog, let's be honest,
I
but
mean,
looking forward to getting out and enjoying the weather.
well, very, very cool.
Awesome. Yay,
Uh,
yay.
yeah.
All
So
right.
talk to
So,
our viewers. Hope you are watching at this point. And Cynthia, tell them what they need to do and what they've won.
well, if you're watching today, no, I'm just kidding. No, those of you that are joining us live, this is a great opportunity for you to connect not only with IHKC founder Lauren Conaway, but with our guest of honor, who she'll introduce in a moment. Welcome to IHKC Live, an opportunity for you to chat with some awesome women founders and leaders in their area and talk about all types of ways to support each other as we continue to push forward, grow, and change the communities around us. What's
That
that?
was amazing. You are so good at
Did we
that.
record that? We should have
Our
recorded that.
executive producer, ladies and gentlemen, Cynthia fails. No, that was gorgeous. You're so good.
Oh, thank you.
uh, well, yeah. So welcome, friends. Very, very glad to have you with us here today on this gorgeous Galentine's Day. Hope that you are taking some time to get out and enjoy this beautiful, beautiful weather. Because we know it's probably not going to last long. We're about due for second winter here pretty quick.
No, on
But
Thursday.
so definitely enjoy it. Soak it up while you can. And another thing that I am hoping that you enjoy is our guest today. One of the things that we talk about a lot around IHKC, we talk a lot about the big issues, the big barriers to success that many innovators, our members, many women, many individuals of marginalized gender experience, many people of color, that the challenges that people face and the barriers that they experience on their path to leadership. And around IHKC, we have the big three. There are tons and tons of barriers, but the big three that we tend to talk about are access to capital, access to affordable childcare, and access to affordable, accessible healthcare. And
Mhm.
so today I wanted to talk to an expert, someone who has been working and enacting what we call radical positive change in the field. And I am extremely honored to welcome to IHKC Social Media Live, Dr. Shelley Cooper of Diversity Telehealth. Hello, Dr. Shelley.
Hello, how are you?
Good. I'm so glad you're here, my friends. If you follow our socials, folks, you have probably seen Dr. Shelley Cooper because we love to highlight amazing women doing incredible things. And so definitely want to say hello to you really quick. I want to say hi to Latia Johnson, Marsha Willis. It is so good to see you. Thank you so much for joining us today. Please don't hesitate to let us know your questions. We will try to address as many as we can while we are on IHKC Social Media Live talking with Dr. Shelley Cooper, this amazing brain right next to me here. We're going to be talking to Dr. Shelley. And you're going to get sick of hearing me say doctor, by the way. I love honorifics. Like when you have earned that doctorate, I'm going to just call you that as much as I can. So buckle up, Dr. Shelley. You are Dr. Shelley Cooper. I want to talk to you about some of the things that you do. But first things first, I do believe we might have some quirky questions. Maybe, Cynthia.
We do. We do.
All right.
Just to preface, Dr. Cooper, these
Uh-oh.
questions are totally random. They're not geared towards the conversation that you and Lauren are going to have at all, but they do give us an opportunity to get to know a little bit more about our guests. So we like to ask quirky questions from time to time. So First question
we
to
should let the audience know that I have no idea what you're about to ask me. So this is
That's
yes.
true. It is true. We are definitely putting
look on
Dr.
my
Cooper on the
face,
spot.
what are you going to ask?
I don't know what the questions are either, if that makes you feel
There's
any
no
better.
idea.
Okay.
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 First question. If animals could talk, which animal would be the rudest?
Possums.
Hey!
They sit in the middle of the road. They know that people are going to run them over, and they just sit there and look at you. And then they look really sad when you run them over and they're squished and their legs are up in the air. They should just move a little faster. I don't get it. So yeah, possums.
So Cynthia's laughing her ass off right now. And I don't know if you know this, Dr. Cooper, but I, in my spare time, such as it is, I occasionally rehabilitate wildlife. And I currently have within my purview a couple of opossums. So the fact that you said that makes I have two of them. I had three. Sadly, Quark passed away about a month ago. But yeah, that is so. It's really funny to me that you just happened to say that.
Well,
and at some point, you and I are going to have get coffee, and I'm going to change your mind. It's true.
I don't know. If we take back roads and it's dark, I'll just tell you, I'm not swerving. They need to get out of the way.
Okay. Well, fair, and I will tell you. Oh, my babies. All right. So I think, all right, the first answer that popped into my head was a badger, because from what I understand, they're just like super aggressive. But now I'm actually going to change it. I think my answer is geese. Because much like, Dr. Cooper, much like you said with the possums, like they just kind of meander down the middle of the road. They just poop everywhere. And I've heard of like legit geese attacks. And so I don't imagine if they could speak that they would be super polite and kind. I think they would kind of be jerks.
That's possible.
Yeah. How about you, Cynthia? What do you think?
Ooh. I just ask the questions. I don't answer them.
I'm gonna get you one of these times. Well, you've answered it a few times, but
I have. Let's keep it going. I'll answer the last question. How about that? The last question.
There's more. Okay.
All right, that's her. Oh yeah, there's more.
With 3 total. So, the second quirky question of the day: what superhero or villain would make the best therapist?
Ooh. Oh, wow. That's different. That's a different one. What do you think? What do you think?
I'm going to go. The first one that popped into my head was Wonder Woman. And I don't actually think, I don't actually. Then I went to Dr. Reed, Mr. Fantastic from the Fantastic Four. I think that's his name. And Reed Richards, that's his name. And I was like, well, he's a doctor. Like he's pretty smart. So I don't know. I'm going to go with Wonder Woman though, because I think that she is a collaborative thinker. She's very smart. She has a lot of empathy as a superhero. So, and I would feel very comfortable talking to any of her incarnations. Like we're talking, Linda, wait, what's her last name? Cynthia? Linda, is it Linda Evans? Maybe? No, I don't know.
I think that was a Dallas show. Wasn't it Linda Evans? I don't know.
It's Linda something. I can't remember her last name.
Linda Carter.
Yes, Linda Carter. All right. So you had Linda Carter, you had Gal Gadot, she's had like different iterations, and I'm like, all of them, I feel like I would trust them as therapists. So there you go. Did I stall enough for you, Dr. Cooper? Do you have
You did.
Okay,
I had that epiphany. Thank you for that. Yeah. I think the best superhero that would make a good therapist is Robin from Batman and Robin. He's always had to play second fiddle. He's always smaller, and it's got those, primary color uniform. Batman has the cool, sleek leather, black, and real deep voice. And Robin's always kind of teenager, adolescent. Yeah. So, I'm sure it was difficult being Robin, even when Robin grew up. And so Robin would, I think, really understand and have a lot of empathy and
Yeah.
I think Robin would make a great therapist.
Well, and he's used to playing a supporting role, you
Right.
know, like you said. Like I think that, yeah, that's a really great answer. I like that answer.
Mhm.
Better than the opossum
Unfortunately,
answer.
there are no takebacks in quirky questions, so I can't change my answer. There is a benefit to going second.
That's right. Right.
I love it. Okay. So the last question, Dr. Cooper, I'm going to have you tell me when to stop. There's a bunch of questions on my phone. And when you say stop, that'll be the last question that we have. Okay.
Okay.
All right. So here we go.
Stop.
And the question is, what makes you smile?
My children and grandchildren. I had my two of my grandkids this weekend, and they did some crazy stuff, but they just make me smile. My 6-year-old grandson lost his tooth on the way out this morning. And I had a chance to take a picture of him before he went to school, and he was so excited. It just made me smile. So
Awesome.
That's really lovely.
it was cute.
So I don't know, a lot of things. I smile pretty easily, I think. So a lot of things make me smile. But today I am smiling because I am talking to two incredible women that I deeply admire. And
Oh.
so that is, that's my in the moment answer. Now, Cynthia, you promised.
I did promise.
Mhm.
Yeah, there's a lot of things that make me smile. I think people and music, I don't know which one makes me smile more, but give me the right song, and even it doesn't even have to have lyrics, but if the music is arranged well enough, that can move me to a smile pretty easily.
Yeah. You smile. You have a beautiful smile. You smile a lot, though. So
I do. Yeah.
yeah.
How do you narrow it down? I don't know.
I don't know. I mean, there's, you know what? There are so many things, and on this Galentine's Day, I'm just gonna say that, there are a lot of things out there to make you smile if you let them. Right?
Absolutely.
That's my wisdom for the day. I did
Yeah.
notice, first of all, hello, Max Sheffield Baird, friend, and longtime member, advocate, fan, supporter of IHKC. Hello, friend. And I do want to point out that Max mentioned the lasso of truth. And I think that they're absolutely right, because as a therapist, Wonder Woman would have her lasso of truth that she could use and be like, hey, you're totally BSing yourself right now. And so there, that's another tick in the Wonder Woman favor. Just throwing that out there. That is an excellent point. Thank you, Max.
And Max did confirm Linda Carter is.
Yes.
All right.
It took me too long to come up with that.
All right.
right.
Y'all
Well,
have some good conversation to get to, right?
for sure. Yeah. Thank you so much, Cynthia. And
Mhm.
Dr. Shelley Cooper, you are now in the hot seat, my friends. We're going to start. I'm going to pitch you a softball first. And I'm going to ask you, tell us about yourself. Tell us about what you do.
Well, I am a former educator. I taught pre-K to higher ed for 25 years. Former business person, worked for someone else, which is different. But now, and for the last 10, 12 years, I have been running Diversity Telehealth. And Diversity Telehealth is a consulting company that has a goal of bringing access to healthcare into underserved areas where underrepresented populations are suffering from lack of access to healthcare. Normally, people of color, lower income, people who don't have the same benefits that other folks would have, being able to just walk into a doctor's office anytime they need to and pay whatever is needed. So with that, I had kind of a spin-off, started a software platform called Come On Now. We're working with Head Start and Swope Health, and we are working to reduce no-shows or the effects of no-shows. So the Come On Now platform replaces no-show and late cancellation medical appointments with telehealth visits. So we're trying to get, right now with Head Start, we're trying to get the early wellness visits in so that the little ones will be ready for kindergarten. And eventually, this is going on in Excelsior Springs, eventually that's going to become a bricks and mortar extension of Swope Health and become a community-based health center within the school. Uh-oh, I lost your audio somehow. Is it me?
No, Lauren, we're having trouble grabbing your audio there. You might check your mic connection. Nope, you're on mute on StreamYard.
Hello, hello. Can you hear me?
Yes.
Okay. So just want to, first of all, acknowledge and honor the work that you do. You know, you are truly an innovator enacting radical positive change. And we're going to talk about what those health disparities that you mentioned look like. We're going to delve more deeply into that. But first things first, I want to ask you this. One of the things that I love about founder journeys is when founders have a personal connection to the problem that they're trying to solve. And I have heard your story. You've been on the Startup Hustle podcast. You know, you have a personal story. You know, you mentioned that you were once an educator and now you're doing this work. Can you talk to us about your inspiration for founding Diversity Telehealth?
Well, the inspiration actually comes from being an educator for those 25 years and earning my doctorate in instructional technology and distance education. So initially, I was going to study distance learning labs. I had my dissertation laid out, it was on the Kansas City Public Schools, and then they lost their accreditation. So a lot of the folks that I needed to get information from went to other locations. And so I'd never heard of telehealth, didn't know what it was, but for some reason that came to me. I know people say, you know, they had a vision. I don't know if I so much had a vision, but it just felt like I've given this much of my life through education. I'd like to continue giving through access to healthcare. And so with Diversity Telehealth, I started that in 2012 and offered my services, being able to bring access to care to schools and to clinics. People weren't thinking about telehealth because they could always go to the doctor on their own. And so it was a really tough climb. And so I've been working with Swope Health and helping them with their telehealth in their telepsych area. And in my studies saw that they had a really high no-show rate. So do other federally qualified health centers, sometimes between 30 to 40% for primary care, which is just, it's a lot. Yeah. And so right about the time that I was working with Swope Health, my father passed away unexpectedly. And so we found that he had a medical appointment and some other specialty care appointments scheduled for after his death. And so I'd been working with the clinic on their telehealth implementation. And I also had finished my doctorate with an emphasis in telehealth. And so with my father passing away, I thought if he would have had access to a telehealth visit, maybe during one of those no-shows, that maybe it could have saved his life. And so even though I started Diversity Telehealth in 2012, my father passed away in 2018, which 6 years later of struggle, but I felt like this is really the best way for me to use Diversity Telehealth. So I started the software platform. So I'd been around for a while before that platform came, and it was a long time coming.
Well, I mean, you have such an incredible journey, and you're such an incredible leader. And I want to ask you, talk to us a little bit about the landscape. We keep on talking about these health outcome discrepancies. You know, I hear about them a lot, and you know, we see. I know that the data shows that often doctors minimize the pain of women. They minimize the pain of people of color. You know, things are missed because there are misconceptions. So like for instance, heart attacks tend to manifest differently in women than they do in men. And so they are sometimes missed by hospital ERs because the symptoms are not presenting. And you see these kinds of discrepancies and this misinformation. And I feel like it's rife within the healthcare industry. The data shows us time and time again that if we could figure this out, we would see better health outcomes for communities. But talk to us a little bit about that. What have you seen? What have you learned? You're a prodigious researcher. What have you researched let's talk about that, where those discrepancies come from.
Well, and I'm glad you brought that up, because as a researcher, I have research information, and then I also have personal information. And
Right.
sometimes it's hard not to mingle the two, or sometimes it's difficult not to have your personal experience be a support for what you've learned, and vice versa. So we know that social determinants of health preclude or stop a lot of people of color or people who don't have access to care, keeping them from getting to the doctor's office. Something as simple as more likely to work by the hour, be paid for by the hour. So it's difficult to have the paid time off. They might have children with chronic diseases. Asthma is more prevalent in the African American community than any other community. And so being able to get to the doctor's office when you have a job that docks your pay if you're gone. Transportation. A lot of people don't have cars. And so if they have to take 3 buses to and from to get to a doctor's office, they're not going to be able to be at work that day. Well, how many days have they taken off? Have they risked their job in that process of trying to care for their families? Or do they live in a food desert? Are there healthy food sources in their neighborhoods? Do they have to pay more for a head of lettuce or a gallon of milk than they would pay for a bag of Doritos and a bottle of Pepsi or Coke? I mean, so what do they have access to? How can they get to it? How much does it cost? And what are the cultural aspects of those offerings? So when they go to the doctor, is the doctor going to ask them, do you have access to food, healthy food? Do you feel safe? What about the environment where you're living? Is there mold? Is there high crime? I mean, is there a lot of exhaust or there are so many things that impact the health condition of people of color, and specifically people of color low income and don't have access to that care as readily as other people, that it's a weight that weighs down on you day in and day out. And if that healthcare provider is not aware of, or at least culturally sensitive to these additional factors that keep certain populations out of the doctor's office, then after a while, people will not go to the doctor until they're on their last leg. And
Right.
that's why there are a lot of people who use the emergency department as their primary care, because
Yeah.
they can't get time off to go to the doctor. And they think, if I could just go one more day, and then they can't go one more day, it's 2:00 in the morning, where are they going to go? The emergency department.
Right. Well, and just a point of fact, the emergency room is more expensive
Right,
than that. So we're talking about preventive care
right.
and how it is an impossibility for certain populations, certain folks who have certain socioeconomic indicators and parameters, and in particular communities of color, folks who come from marginalized, historically excluded groups, and so what I heard you say, we have people who have difficulty accessing not just care but culturally competent care,
Mhm.
from doctors who either understand all of these different factors and have empathy for it, or doctors who have lived it. Finding doctors who look like you can be a really, really challenging thing. Another thing that I'd be curious to hear your thoughts on is, we have culturally, from what I understand, there are a lot of individuals, in particular in African American communities, who are distrustful of the
Mhm.
medical community because they can't find doctors who look, think, and act like them. And then, historically, you see situations like Henrietta Lacks or the Tuskegee experiments, where individuals have been royally screwed by the healthcare community with no respect for, a person's agency and a person's dignity. And it must be pretty difficult to overcome not just those very physical barriers, those very, very economic barriers, but cultural barriers as well. Have you found that in your research, or am I just way off base?
No, I've definitely found that in my research. There is an additional dynamic that I'm not sure very many people are aware of, but you might want to do some research into early gynecological studies. A lot of those gynecological studies were done on African American women without anesthesia. And so thinking of
can you imagine?
Well, yeah.
You're like, yes, I can.
Yeah, we kind of can. And so, and another thing and you can check the research on that as well, is the amount of anesthesia and care that is sometimes given to African American patients versus the majority population. And one example actually experienced this, and I was blown away when this happened. And sometimes I think, did that really happen to me? I went to an endodontist. I was having trouble with my gum. Oh, no, it's periodontist, whichever one. Okay. Well, whichever one. I'm not that kind of doctor.
I think a periodontist is the gum.
The gum. Okay. Then it was an impacted tooth. And so we had to do a lot of surgery there. And so I went in, and the whole time he's drilling and drilling. And I said, I can feel that. I can feel everything you're doing. He never stopped.
Yeah.
No more anesthesia. None of that. He just kept drilling. My hands are flailing. My feet are kicking. And I'm saying, I can feel that. Now, what kept me in the chair? I have no idea. I should have just gotten up and walked away. But I didn't. I thought, well, maybe the pain will stop, or maybe he'll realize that he's definitely, and not in any type of unusual way, hit a nerve. He hit a nerve, and he kept going and kept going.
And didn't listen.
And didn't listen and didn't stop.
Yeah.
And there was a dental assistant in the room, and her eyes were just as big as mine. We couldn't figure out, why is this man not stopping? And eventually, when he finished drilling to the point where I think I was close to unconscious, I went to the front desk to write my bill, write out the payment for the bill, passed out. I was on the floor, had to be taken into a darkened area in a wheelchair because my blood pressure was over 200. As a result of that incident. And the whole time I'm thinking, I don't think, and I'm not trying to be in any way disrespectful, I think if I'd looked more like you, and you would have said, I can feel that, oh, let's see if we can get a little bit more medication in there. Let's see if we can stop a little bit.
So I would agree with you, but I will say that we do also see that like that minimization of experience. White women experience it as well. And I think it's one of those things where, I feel as though maybe the healthcare community feels that women tend to be more hysterical and more, I don't know if it's weakness or what have you, but they think that we're overreacting.
Oh, definitely.
To the pain that we're experiencing. Yeah. And I absolutely believe that it compounds with every intersectional identity that you layer on. So,
that's right. That's right.
I am 100% confident that Black women experience it at much greater rates than white women. But I do just want to acknowledge, women, we experience it.
In varying degrees, I would say.
Right, exactly.
A similar situation, and this isn't becoming a gripe session, this is just a second of the two experiences I wanted to share. At the dentist again, a different dentist.
Oh, man. Incidentally, when we're done here, I do have a dentist that I would love to refer you to. She's amazing.
I've switched.
I just want to give you a big old hug. And really quickly, I do just want to acknowledge Latia says maybe, but it's not near at the same level. And I absolutely 100% agree with that. So thank you for, keeping me accountable. I do. Let's just acknowledge that, hey, women of color, I am so sorry. And I'm so sorry that you have so many, you've had so many issues with dentists in particular.
Yeah, what's the deal with that? I don't know.
I'm so sorry that you experienced that.
The last one, and I have found a wonderful dentist, Dr. Dokes on the Plaza Smile Salon.
Yeah. Okay, good.
Anyway, and she is a dentist of color as well. So
wonderful.
Double blessing. So no, just another situation that kind of reiterates what you just said about women being perceived as possibly hysterical or easily excitable, having a really, really sore tooth. and mentioning it's the one right here, and the dentist goes bang, 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 and I kicked at my foot, and he goes, "There's no reason to what do you say, overreact." And I thought,
Gross.
and some people might listen to this and say, "You've just got a poor choice in dentist. You need to, now that you found one, let's continue with this one."
Yeah.
But it's just when day in, day out, things happen, and after a while, you just feel a little overwhelmed. Is this related to what I look like, or is this just an incompetent medical professional? But
Yeah.
with the history of African Americans and other people of color in the U.S., I would not say it's a single incident. So
For sure. Well, I mean, yeah, the data bears it out time and time
Mhm.
again, and every single Black woman I know has a story, and it's just heartbreaking.
Mhm.
Well, so that leads us to an interesting point. And friends, I do want to remind you, if you have questions, this is live. If you have any questions for Dr. Cooper, please don't hesitate to put them in the comments. We will try to address every question that we can. Feel free to share your experiences. Hopefully, this is a healing space. Let's talk about some very serious issues that we as a society need to address, but let's do so in the hopes that, God, if we can talk about it, can we fix it? So at any rate, Dr. Cooper, I want to ask you this. One of the things that I have learned is that often you are your own best advocate in your healthcare, right? And I want to talk to you a little bit about that because clearly you have had to advocate for yourself. I don't understand how you don't hate all dentists at this point, but I'm glad you found one you like. But, talk to us a little bit about advocating for yourself with your doctor, because I feel like sometimes people might be intimidated, or they might feel if I speak up, I'll be seen as there are any number of reasons that people might hesitate to speak up in their own defense and as their own advocate. But I want to talk to you about that. What has been your experience? You've worked with a lot of patients over the years. What are some of the conversations you've had, and how have you become an advocate for yourself in your own healthcare?
Well, what I found is that if we don't know about our own health history and we're leaving it to the doctor to tell you everything about what's happening in your life, we're not being advocates for ourselves. And what I mean by that is, do we know our blood pressure? Do we know our BMI? Do we body mass index? Do we know all the vitals about our own bodies? Some of them may not be necessarily where they should be. And I'm one of those people because I do take a blood pressure pill and I need to lose some pounds. I won't mention how many that might be, but we'll keep that off.
You are absolutely beautiful. So I just everything about you is absolutely beautiful. So I refuse to believe that, but
well, for health reasons, and you're kind, but for health reasons, we need to make sure that we stay at a healthy weight, that
yeah.
we eat fruits and vegetables, and that we also drink enough water and all of those things to get enough exercise. And for me, I'm still working on those things, but at least knowing where you are, knowing what you need to do, knowing you need to get an annual physical and a mammogram if you're at that age.
And
also,
what's the mammogram age?
now the mammogram age that I have been most familiar with is 45,
Okay.
between 40 and 45. But you would really need to discuss that with your doctor, because if you have a family history of breast cancer, you would need to go in sooner. We have a family history of gastroenterology or gastric illnesses. And so I had my first colonoscopy at, I believe, 45. And normally you have it much older than 40, between 40 and 45.
But you elected to do it earlier because you knew that you had this history that made you more prone to issues.
Right. When you complete the surveys, the survey questions, when you go in for an annual visit, they normally ask you if you have a history of these certain situations. And if you do, then they recommend that you take some of these some of these preventive measures earlier rather than later. I also had a cardiac scan earlier in life than most people do. And I know it sounds like I'm probably a hypochondriac, but I know I don't eat the way I should. I know I don't exercise the way I should. And my husband has Monday and Tuesday are his fruit and vegetable days. So I make sure that I make fruit and vegetable dishes for him. Now I'm going to still have a burger, but he's going to have a salad. I'll have a salad with my burger. So
I was gonna say, like, does the tomato and the onion and the lettuce on the burger count as a salad?
The ketchup on the burger was at one time a tomato, but no, I'm just teasing. But I think it's really important for us to be aware of when we should have mammograms, when we should have our female exams, when we should take care of our bodies. How often have we been to the doctor? What is our average blood pressure? And all of those types of information about our physical well-being as well as our emotional well-being. It's not just our physical health that we should be really aware of, but also our emotional well-being. And I happen to know that a lot of times when people are hurting physically, it could be a result of an emotional issue and vice versa. So we need to make sure that we're aware of both of those, and where do we get care? In the African American community, especially African American men, there's a deficit of emotional and behavioral support. So not only are a lot of the folks who are in the communities of color have additional stresses and strains just in everyday life, there's not the additional support that should be there for those types of situations. And so emotional situations can often manifest themselves in a physical way.
For sure. Well, so that's a lot of really, really great advice. We did actually have an excellent question come through the audience. Looks like it came from Latia Johnson. Thank you so much for throwing your question out there, but I'm going to go ahead and ask it. How do you address issues with specialists that generalize your illness and don't give you specifics, like seeing X-ray results, etc.?
I've always felt that if you don't feel like you're getting the care you deserve, that you should find someone else. As an example, with the dental situations that I mentioned, I no longer give those people my money, and I no longer allow them to make decisions about my dental health.
Yeah.
So,
what if you're in the moment though? Because like I've had situations where I've been with my doctor and I've had to, slow him or her down and like, hey, talk to me like I'm a human. Don't throw this jargon at me that I don't understand. And I can see how like that kind of advocacy in the moment,
it's hard.
It could almost seem like adversarial to some. Like it could be very intimidating. And so, I would urge and encourage people, like, if you feel that you have the mental and emotional capacity, like, advocate for yourself in the minute.
Right.
But that being said, I don't want to make my doctor treat me like a human. I that's ridiculous. Like, I think that doctors, if you are doing patient-facing care, then you need to be able to have at least some semblance of bedside manner with me.
That's right.
Talk to me like I'm a human with respect, like I have the agency to make all choices regarding my healthcare. Like these are not difficult things to me, and yet it seems like people come across they find issues with it.
Yeah.
Is that kind of what Latia, I love that you are so engaged, but yes, what are the rules? Talk to us about the rules.
I can't give rules for everybody. I can give rules of what I do.
Yeah.
If I don't understand what's just been said to me, I don't understand. Can you explain that to me? And there's the Zoom buy because they've got to see so many patients an hour in order to meet all the expenses. I still don't understand. Can you give me resources on where I can look up this information? Can you refer me to someone else? I'm trusting you with my life. When I come here to see you, I'm trusting you with my life. Can you please explain to me what I should do? Is this something I should be concerned about? Is there someone else I should seek? Are there medications that I should take? What are the side effects of this medication? And if they give you the zippity doo dah and want to get you out of there, well, it's time to go somewhere else. Now, I say that as someone who was passed out on the floor from having someone drilling my teeth with next to no anesthetic, but we need to be able to stop them and say in a kind way. It's hard for me sometimes to be confrontational, but you can be insistent and be Kansas City nice, and people know what that means. Syrupy sweet to the point of you just want to spit them out of your mouth. They want to get you out of that office so quickly. Well, doctor, can you please explain? I know it sounds like we're being subservient, and we're not. We're being insisting on getting the health care that we need by any means necessary. And if that means this person needs for you to plant them yourself in their office and say, I can't leave until I understand what you're saying. Can you please explain this to me? I really feel like there's more here than what you're showing me on the x-ray. Can you please explain it to me?
Yeah.
And put it back on them. They're the expert. They're the ones that went to school to learn how to do this. We're just trying to get the information and live as long as possible.
Yeah, when my father-in-law, before he passed, he was having heart issues, and I actually, he was in Springfield and I wasn't there, and so I was getting all of my information secondhand. But I could feel the frustration from my husband and his sisters, because the doctors would just like scream and take off. And so finally, I actually reached out to a friend of mine who is a doctor. And I was just like, can you please explain this to me in words that I understand? Because there's a lot of, anytime you hear any kind of news about your health that isn't explicitly good, it's concerning. So you have like a base level of anxiety, right? Mm-hmm. But if you don't have the tools and the support and the knowledge to understand what is being said to you, that anxiety just ratchets up insanely high, right? You know, it's just, again, we have a compounding situation, fear about your health, but also fear of the unknown, I feel like.
Right.
So I advocate for, ask for what you need. And I love that, but also don't be afraid to go. If it no longer serves, then it no longer serves, and you need to get out. You need to find a doctor that will support you and respect you and take good care of you. So Latia asks again, thank you. It's nice to know the questions we should ask. It can be intimidating to not want to appear difficult. And Dr. Cooper, what would you say to Latia about that? I have thoughts, but I want to hear your thoughts.
I definitely agree, because there is the angry Black woman that if you're asking too many questions and they sense a tone, then they just kind of push you to the side and consider you the angry Black woman who cannot be appeased and cannot be satisfied. So now it's time to call security, or now it's time to check off on the patient record that we need to transfer this patient to someone else. And we don't want to be excused and dismissed. We want to be taken seriously, because we are, like I said, I'm trusting you with my life. So we need to be insistent and assertive, kind and respectful, but we should also get the same treatment in return. So
for sure,
that would be my response.
Well, thank you so much for that. And I'm going to ask you, Dr. Cooper, if you could share your final thoughts with us. We've talked about a lot of things. We've talked about discrepancies in healthcare. We've talked about, who would be the best therapist as a superhero. We've talked about a lot of stuff. But I'm going to ask you, as an expert in this area of knowledge, what is one thing, and I know I'm putting you on the spot, what is one thing you wish people knew about advocacy in their healthcare, about healthcare inequities, anything that we've talked about? If there was one takeaway that people could go home with and will go home with, what is that for you?
I think for me, especially as an entrepreneur and in the field of healthcare, it's overwhelming, the inadequacies in healthcare, the inequalities in healthcare. And we have to take it one brick at a time. If that means your family, your health itself, your friends and family, then that's what we need to do. But I think the most important thing for us to remember is we are the patient. We control our medical dollars in most times, even if we're Medicaid or the money follows the patient. So you need to let the doctor know, I want what's best for me. I want what's best for my family. The doctor is human too, and they have families. Would you tell your patient, or would you want your family to receive the same medical information that you're giving me? So somehow try to humanize as a patient, humanize your provider, because they're people just like you, and they went to school to learn how to do this. They weren't born knowing this, but just letting them know, I'm a human being, you're a human being. I want you to give me the best medical care that you can give me, the same level of medical care that you would want your family to receive. Are you doing that for me? I think that's an honest question.
Yeah, that's a very mic drop question. And it's a perfect note to end things on. I love that. Dr. Cooper, I hope by this point, you know how much I deeply and admire you and the work that you do. And I just want to, we see we've got thank yous coming in the comments. You've probably seen those flash across the screen, but I do just want to offer a very innovator thank you for everything that you do to close those gaps and stem those inequities. It is an honor to know you, my friend. And thanks so much for taking the time to chat with our members and our listeners. You've shared so many gems, and I knew that would be the case.
Well, thank you. I appreciate the invitation to speak with your group and always to talk to you. You're always so sweet and you're always so supportive, and I do appreciate it. So, if I had a show, you'd be on my show. But
all right. You know what? I'm going to hold you to that someday when you have a #1 healthcare podcast, whatever you want to do. I am there to support, but I look forward to that day. Friends, we're going to go ahead and wrap things up. I thank you so much for taking the time to listen and hopefully learn. I don't know if you didn't learn with Dr. Shelley Cooper at the helm, then I don't know how to help you. But thank you so much for taking the time out of your busy schedule to give us a listen. Please definitely make sure to, I feel really, really strongly that we need to share this information. So if you could give us a quick share, that would be greatly appreciated. As far as what IHKC has coming up, friends, we are in the thick of Black History Month. So please keep an eye out for profiles and information around Black-owned, Black-led business here in the Kansas City area. We proudly promote that year-round, but in particular during Black History Month. We have Women's History Month coming up in March, and of course, that is a big, big deal for us. So much so that we have a whole bunch of events, and I am going to look at my phone to make sure that I don't miss any, because we've got a bunch. So our monthly meetups happen the first Tuesday of the month, March 7th. We will be having a happy hour. I'm going to be real honest. We're actually working out some of the details on a really exciting collaboration event. But I don't have anything to share right this very second. So just know March 7th from 5 to 6:30, Innovator is going to be doing something. And it'll be really cool. Keep an eye out for that. We've got on March 8th, which is International Women's Day, we have the She Is Women's Luncheon with Metropolitan Community College. We're going to be talking to women who work in predominantly male industries. And Cynthia, happy early birthday, Cynthia. We're not gonna make you do anything on your birthday. I hope you know that. I want to take you out and celebrate you properly. But we also have a Keystone collab session. We do those every other month with the Keystone Innovation District down at their headquarters off of 18th. So we're going to be having a conversation with some really cool women in sports, because now I'm not a sports ball person, but it's not Final Four. The Big 12 is in town. So we're going to be talking to some sporty women and for our Keystone collab session. And then on the 28th, we have an event in partnership with Women of Top Gun of Kansas City, as well as the Kansas City Girls Prep Academy. And we're going to be having a panel discussion around educating young women in particular, but educating educating for women with some really, really exciting panelists. So keep an eye out for all of those things. We have a calendar on our website, innovateherkc.com, that you can subscribe to so you never miss one of our events. We would love it if you would do that. You just go to the calendar page on innovateherkc.com. We also post our events, and I'm a little bit behind, but we post our events on our public Facebook page, the events tab, as well as on LinkedIn. So keep an eye out for upcoming events. We're going to have a crazy busy March. Hopefully we all survive it. We got this. And thank you so much again. Cynthia, if you want to come in, Cynthia always does this beautiful thing where she knows how to tell people what to do at the end of our broadcast, because I always forget. And so as our amazing executive producer, our voice of goddess, I'm just going to like pick on you and be like, can you do it? Though, please?
I put it in a private chat. I was hoping you would do
you
it.
did?
But as always, lovely. Thank you so much for tapping in and sharing part of your day with us. Dr. Cooper, we really tremendously appreciate the knowledge that you poured into us today. Lauren, thank you so much for driving this conversation. We hope that it creates ripples of impact everywhere it has landed thus far. And in order for that to happen, we need you all to not only like the video wherever you're watching, we need you to share it. Share it directly with people in direct messages, or share it to your platform wherever you're watching. Make sure that you drop a comment in there so that the algorithm starts to work in our favor. And if you're watching on YouTube, make sure that you subscribe, hit that little bell so that you get notifications when we go live. How's that, Lauren?
You're amazing. You're just fabulous. Like, I'm sitting here counting them off, and I'm like, yep, would have forgotten that. Totally would have forgotten to say that. But no, you, as always, you did a beautiful job, and you always do a beautiful job with our social media lives. Thank you so much for being the hostess with the mostest. I don't even know if that's the thing. And our executive producer. You're amazing. And now we're going to get out of here. I'm going to do finger guns for everybody, because apparently that's a thing that I do. And this is how we're going to close out. Thanks for joining us, friends. We'll catch you next time.